Once on therapy, how is the disease monitored and how do you know if the treatment is working?
Well, fortunately, we use the same markers so that, once a person is on therapy, we will be monitoring, and we monitor at least on a monthly basis those myeloma protein markers. Once a person reaches a great level of response, sometimes we complement that with an analysis of the bone marrow. Of course, it's more invasive, so we don't like to do a lot of them, but we do them as needed. As we go forward and monitor patients, we will be looking for signs that those proteins remain in a low level and stable as an indicator that the disease is under control. Now, if I saw someone and then I start seeing that there's an increased concentration of those proteins, or we see something else clinical, we might need to do a little bit of a regrouping and test again in great detail to determine if the person is experiencing regrowth of the disease, the so-called relapse.
Why is it so important for patients to speak up when it comes to symptoms or treatment side effects?
Well, that's a great question. If you don't speak about them, we don't know about them, and it seems very obvious, but then we cannot make the proper adjustments. And I'll give you a couple of examples. I already talked about dexamethasone, but a common drug we use is something called bortezomib. Bortezomib is a proteasome inhibitor. That's a mouthful, but it's one of the key type of drugs we use, and it's given as an injection under the skin. Not to be confused, by the way, with daratumumab, or there's the Faspro is the name of that medication. So not to be confused with that, there's bortezomib, which we have been using for many years. But bortezomib has a potential toxicity that is called peripheral neuropathy. And if patients have peripheral neuropathy, that can go from very mild, where you have some numbness and tingling, to the more extreme cases that is associated with, pain, discomfort, even weakness and disability. Well, if we don't know that that's happening, then we can't react to it, and we can't adjust doses or switch to something different altogether. And you can imagine, now we have more options, but in the old days, I always tell patients, you might be tempted not to say anything about this, because you might be thinking, boy, this is working. I don't want to interfere with my treatment. I can live with a peripheral neuropathy. But if it gets worse, then despite the fact that the treatment is working, the person might have a very significant impingement on their quality of life. And more so now that we have so many alternatives, it's important not to get us into a path that we might reach a point of an irreversible chronic complication from treatment.